You've already had lessons about infection control in the dental office, and there's really not that much different when it comes to radiology and in the radiology area. But there are some things to kind of keep in mind that do separate it a little bit. And the biggest one is handling of contaminated films. And when you took your film full mouth in lab, if you remember, I had the little plastic cup, the non-permeable cup, and you would take the film out of the stack, go in, place it in the patient's mouth, expose it, then bring the contaminated film back and drop it in the cup without touching the outside of the cup. This is just kind of a written out version of exactly the same thing. The benefit is that once you're done taking the set of bite wings or the set of full mouth, you have all of your contaminated films inside the cup. So then you can take off your gloves, wash your hands. It's a non-permeable cup, so you're able to pick it up from the outside, which is clean if you haven't touched it, take it into the dark room. Now, ungloved with clean hands, you can close the door, turn on the lights, turn on the processor, turn on your safe light, get everything situated the way that you want it, then turn off the lights, and you're ready to put your films in the processor. So you glove up, you take your film out, you open that contaminated packet with your gloves on, and put them into the processor to be run through. And like I said, this is just kind of a written out version of that, so you can kind of think back to that film full mouth and kind of the steps that you took. And the reason that we do it that way is it prevents you from being gloved up and having to touch door handles and touch light switches. It just really expands what all you have to go back and remember to disinfect. So this way you have clean hands, so you don't have to go back and remember to disinfect all of those things, and you're not cross-contaminating everything in the whole office because you're carrying contaminated films into another room. Another kind of a similar method to this that I've seen some offices do, if they don't have little cups like we had in lab, a lot of times they'll have just a separate stack that they put the contaminated films in. When they're done, they'll pick them up in their gloved hand, take the glove off, so now the films are inside the glove like a little baggie. Then they take off the other glove, wash their hands, and they're able to carry that glove with the films inside into the dark room, and it serves the same purpose. It's just a different non-permeable container to carry the films in that were exposed because they are contaminated. Everything else, your instruments that you use to place the films or the sensors are disinfected and or sterilized between patients. Your sensors, a little different than film because films are disposable. Sensors need to have barriers on them because it is a very difficult surface to clean. And anytime you have a difficult surface to thoroughly clean, it needs to have a barrier on it. You're going to disinfect it anyway between patients, but if you think about the sensor, it has the little crease in it where the front and the back snaps together. The cord coming out the back has a little adaptive pieces, and then you have the cord, then you have the button. There's just a lot of parts of it that are hard to disinfect. So it's really important to have a barrier covering that sensor. If the barrier tears, which does often happen, go ahead and replace the barrier because that's just going to limit the amount of contaminant on the barrier or on the sensor itself. Something that a lot of people don't think about, and in our case, we have the wall mounts that the sensors stay in. That is when the sensors are clean. When you've used a sensor, hang it over the keyboard or hang it over the wall mount for the lead aprons, or hang it somewhere stable so it's not going to fall on the floor. But don't put it back in that wall mount because that's another thing that you have to disinfect if you contaminate it. And again, it's another very difficult thing to disinfect. And a lot of people don't think about that. They put the sensor, when they're done using, say, the size 2 sensor, they put it back in the wall mount and move on to the size 1. Well, then when they clean everything, they take the barriers off the sensors, they put disinfect it, they put a new barrier on it, put it right back in that little cradle on the wall. 9 times out of 10, I bet they do not remember to disinfect that wall mount. So just some things to keep in mind. Anything that you touch, you got to disinfect. So when it comes to panoramic machines or cephalometric machines, any of those things, I always say anything that you touched or the patient touched has to be disinfected and new barriers put back on. Anything that can be autoclaved should be. So your instruments, some of your extra oral machines have either disposable or cold sterilized bite pieces. So just kind of keep those things in mind. Anything that you would do in an operatory to keep the operatory clean, to keep from cross-contaminating everything, you'll do all of those same things in the operatory where you're taking radiographs as well. This is also a good place to talk about documentation. Documentation of radiographs needs to be done if a patient comes in and you take a full mouth series and then go on to do all these other things. Make sure that you're documenting the full mouth series. Your dentist may also want to keep a record of retakes so that they have a record of number of exposures. So that may also go in the patient's chart. But even if you just take one periapical, patient comes in, they have a toothache, tooth number 18, and you take a periapical or a PA of tooth number 18, that PA has to be documented in their chart. A lot of offices, you're going to be documenting it anyway because they're going to want reimbursement and payment for that periapical. But make sure in the clinical notes when you're writing those up, that is still a procedure just like anything else that you do. So that procedure needs to be documented as well.